Thomas G. Hedberg of International Medical Crisis Response Alliance, which is a UN-affiliated medical NGO. Today, we are privileged to have a first-hand account from a strong and otherwise healthy young family man of the experience of contracting and living with COVID-19 infection. COVID has hit close to home in this particular case, and the gentleman who has been gracious enough to share his experiences with us and to answer our questions and to provide these details is a close associate of IMCRA at our New England headquarters. We present this interview as an insight into why it is so important to utilize all available techniques and protocols to avoid contracting this disease in the first place. If you have any questions about this presentation, please see our placard at the end of this video and feel free to direct anyone toward this website and this video module at any time. This video module presentation and its contents are the property of IMCRA and are protected by international copyright law. Well, thanks for joining us here at IMCRA and for sharing your experience with healthcare workers and others worldwide.
My pleasure.
When did you first learn that you had contracted COVID-19?
I assume you're referring to the date, the exact date?
Well, yeah, around the...
I first learned about it on March 31st of this year, 2020.
So fairly early in the start of...
Fairly early, yes. I contracted it fairly early.
What were your first symptoms?
So my first symptoms was severe headaches, then a fever, then I start coughing a little bit, shortness of breath, of course, and the shortness of breath was the hardest part of it all.
Now, when you began feeling these symptoms, did you interpret them as coming from something else, or did you immediately suspect COVID?
So I wasn't sure what to make of it, of course, but I have a family, a wife and two daughters, young daughters. Wanted to protect them, and I didn't want to take a chance. So immediately I closed my room and put myself in quarantine with them in my own house. And a few days later, immediately I called and I set up a test, and it took, unfortunately, at the time, it took almost a week to get results. So I suspected, but I totally didn't know, obviously.
Well, it was still in the early days.
It was very early days.
Yeah.
Yes.
Now, what would you say was the transmission vector? In other words, where do you think you acquired the infection?
Oh my God, it's so impossible to know, because you come to work, you're interacting with people, you go to the supermarket, you're interacting with people, you walk on the streets, you may be interacting with people. It's almost impossible to know where exactly did you interact with it.
So you had no idea, really?
No clue.
What, if you can tell us, what did your doctors tell you about whether or not you would require hospitalization once you were diagnosed?
So I had an interesting experience. As I was getting a little sicker, meaning fevers goes up and down, and as my shortness of breath became more severe, and my coughing got a little harder, I decided to go to a hospital on my own. I didn't consult with a doctor at the time, and I drove to a hospital, local hospital, and they tested me and they took an X-ray, a chest X-ray. While I still didn't get the results, it was only 2-3 days after I took the test, because my symptoms got harder and fairly fast. Every day my condition got deteriorated. So like a week after my symptoms started, I decided to go and to go to a hospital. And they said, it looks like I have the COVID, based on all the symptoms I had. And I was sure they're going to hospitalize me. And they decided that I didn't need hospitalization because my oxygen level was still okay. And even though my lungs seemed to be severe, they didn't feel that I should be hospitalized. So they sent me back home.
Yeah. And that was it? You stayed home for the rest of the course of the
No, of course not. So we basically, we were at a point where we were actually moving out of New York City. I live in New York City. We were moving out of New York City for 2 months to Pennsylvania. And same thing, we rented a house, and I basically locked myself inside the bedroom. But my condition started getting really bad, to a point where I was having a seriously hard time even getting out of bed. The food, my favorite food, coffee, all tasted like hell.
Yeah, right.
So I lost a lot of weight, because I was eating 1 small meal or 2 small meals in a day. And my wife was keep screaming, "Are you okay? Do you want me to call an ambulance? Do you want to go to a hospital again?" And I'm like, no, because the first experience wasn't exactly accommodating. So I wasn't sure how bad do I need to get to actually be hospitalized. So I waited. So the first time I went to a hospital was on a Sunday. The next time I went to a hospital was on a Thursday. But at that point, it got so bad that my wife called an ambulance. And they asked me if they should come and pick me up, or I will meet them downstairs. And I said, "Oh, no, come downstairs." I got out of bed, and I couldn't breathe. So I ran back right into my bedroom, into the bed, and lay back and started breathing again. And they came and picked me up, and they took me to the hospital. At that point, we already got the results, and there was no question that I was sick with the COVID. And I was hospitalized on that Thursday, and I started taking the medication that they had to offer all the time. And the first 3 days was probably some of the worst days in my life. But then it started getting a little bit better. The part where you can't move because any move would put you in a situation where you can't breathe was
that
devastating.
Must have been distressing.
Devastating. We basically, so I've been in the hospital for a week, exactly a week. I was hoping I'll be there 3 days, but I was there for a week. And as I said, 3 days, I couldn't move much. The hardest part was when I needed to do my needs, and I couldn't. It's like preparing yourself.
I can imagine,
You're preparing yourself for an hour or two.
Really?
Because just to know that you're about to get tortured for about 15 minutes before you actually can settle down.
Right.
So, like I said, after 3 days taking the medication, it started feeling better. So I was able to actually get out of bed and sit. And while it wasn't easy, it
Major accomplishment.
It was a big accomplishment. One of the things that they asked me to do, which probably was helpful, was to lay on my bed, on my stomach, for at least 4 hours a day. It was not easy because I'm not used to sleeping on my bed. So I slept for, I laid for a couple of hours, took a break, laid for another couple of hours. I've done everything I needed to do. It was hard. And I made sure that I eat. It doesn't matter how bad it tastes. My wife cooked me daily and brought the food in. And it was a lot better than the hospital food, which was, it's bad to begin with. It was a lot worse with everything else I was going through. And I started feeling better. And, then before I left, of course I was connected to the oxygen.
Yeah.
It wasn't breathing, but it was just an oxygen tube. And, before I left, they gave me that spirala where you actually breathe into it and you practice your lungs. And I took it as a challenge to and practice it all day long.
Yep.
So all those things together helped me out to recover. At that point, I was basically, they drove me back to the hospital, took me back home. The ambulance took me back home. And I stayed in quarantine for another 10 days inside that room. There were certain protocols that says that 3 days after you have your fevers, you pretty much can get out of quarantine.
Yeah.
But we decided to be
extra
careful. We waited 8 days.
Yeah.
We spoke to many different doctors and they all felt the same way. And I started getting better. I didn't need the oxygen anymore. I still felt shortness of breath, but not to a point where I couldn't function at all. I could now walk, at the very least walk, and I could eat, and I could do all of those things without actually feeling that I'm dying every single time. And then I got out of the quarantine. I got downstairs and I joined the family. And just to find out a week later that I still have. It's live, it's kicking, and I went to get tested. So my wife and my daughters got tested again, and we all got it.
You all had it.
We all got it. And I assume that we got it because we got out of quarantine way too early.
Yeah.
So it took from the time I got it to the time it was actually gone, and I finally tested negative. 2 months.
Wow. So this required a certain degree of bravery on your part too, to put up with all of this.
Well, we all have a survival mechanism. It doesn't take bravery. It takes you do what you need to do to recover.
Have to do. Exactly.
You do what you need to do to recover. That's but I certainly work hard to try to recover as quickly. I remember that even a month later, after it took my shortness of breath was lasting for 3 months from the time I
first
contracted it. And but the minute I got out of the hospital, I started working out.
Sure.
And I was hoping that this is going to help me to clear up my lungs and everything else. And now what is it? August. So what is it?
August 18th.
5 months after, and I'm fully recovered. I'm back to almost normal in sports, and
well, great. If I may, let me ask you, because we've actually covered some of the other questions here. Did your physicians at any time begin a procedure to trace others that might have transmitted the infection to you?
So
And people that
everything-
you had potentially infected since contracting COVID?
So it was very hard, some of my friends that I came in contact, they got tested. Some of my employees got tested. Because truthfully, from the time I got it and even a few days later, we were already in somewhat of a quarantine. We weren't coming to work as often as we, and we weren't actually, we were actually trying to be careful even before this whole, before I contracted it at the beginning of March. I'm sorry, at the end of March. So
Yeah.
March we were already in quarantine. So there wasn't much that I could, but whoever I came in contact did get tested, yes. And, talking to doctors was somewhat frustrating without actually trying to blame them in any way,
Yeah.
shape, or form, because they didn't know anything.
They didn't know
You know,
anything at that
There
time.
was few guys out there that tried to pretend to be smarter than others and pretended that they know, but they didn't really know.
Yeah.
And there were one that were 100% honest about it. They said, "We're still learning it. We don't know anything about
Sure.
it."
No, the tracing procedures have really evolved since that time. But for you to contract it in March, they didn't really have
Not
effective
much.
procedures in place.
They didn't know what works and what didn't work
Yeah.
and what medication works, didn't work. The truth is that there's still an argument whether the medication I took was working. I think it worked on me. Obviously, a couple of days later, I started feeling better. Where before it was actually I was getting worse and worse. It must have done something.
Yeah.
Because
It was symptomatic treatment, primarily.
yeah,
So, but you're going to defeat it on your own, with your own immune system.
it helped.
Yeah, that's fantastic. Did they tell you anything about the long-term effects of the disease?
Yes, I was super concerned about it.
Uh-huh.
And obviously I was trying to set up because my heart rates for a very long time wasn't normal. It was going up and down,
Yeah.
more on the up than the down. And my shortness of breath obviously lasted for a very long time. So I was obviously very concerned that some of my organs got damaged, that my lungs are going to have a long-term damage or effect. So I was concerned about my heart, potentially kidneys and liver and
Sure.
whatever else. And so yes, I was they talked about it, and I was very concerned about it.
So, has there been any recurrence?
But thank God, I did an X-ray
Mhm.
and testing on my lungs, and everything is 100%
Good.
clear. It's
Clear.
good. I recently had they tested I did a stress test with what's the name of the heart test? I forgot.
Echocardiogram?
Thank you. I did that, and everything is fine. And so it seems that everything went back
Good.
to normal,
Good.
at least in my case,
Yeah.
and hopefully in everybody else's case.
We hope so. Well, this is pretty detailed. I want to thank you for joining us. Your insights will really go far toward informing people who need to hear and see what a first-hand experience with COVID-19 was actually like.
Well, thank you very much. It's my pleasure. And
You're
hopefully
welcome.
we'll see this pandemic behind us sooner than later.
This accurate and somewhat harrowing first-hand account of infection and subsequent severe illness with the novel SARS-CoV virus was provided only through the kindness and bravery of our associate here at IMCRA. Clearly, the course of the illness can be exceptionally severe in some individuals. And without doubt, the best course of action is to avoid infection in the first place. Needless to say, by avoiding your own infection, you cannot infect others. If we allow 2 to 3 weeks to pass with no new infections, and we curtail travel so that no new cases can serve as vectors for disease transmission, we can and will finally defeat COVID. Once again, we want to thank you for your attention and for your patronage of IMCRA, and please don't hesitate to visit us at our website, www.imcra.net, and to make a donation, if you will, to our work at Global Giving. Until next time, thanks again for your attention, and good health.